Hello, myself Dr. Samiksha. I am a homeopathic psychiatrist and the counselor. Today, we're going to learn about post-traumatic stress disorder, its sign and the symptoms. In the previous video, we learned about what is exactly PTSD, how common it is, what exactly are the trauma and the traumatic events, the types of PTSD, and what exactly happen in the traumatic events. So today we're going to see about what's the sign and the symptoms. So क्यों sign and the symptoms जानना जरूरी है? Because अगर you are aware about what is exactly the PTSD and what are their sign and the symptoms, you know कि कब आपको ट्रीटमेंट लेनी चाहिए और अगर आपके लव वन सफर कर रहे हैं या नहीं कर रहे हैं या उनकी हेल्प करनी चाहिए या नहीं करनी चाहिए. So we'll see that. So the PTSD symptoms, it may start within a 1 month of a traumatic event, but sometimes symptoms may not appear until the year after the event. So for example, अगर मेरा एक्सीडेंट हुआ है स्कूटी से, so it may possible after the event, I may have a fear, anxiety to go outside or to drive. And because of that, I am having a troubling in my daily activity. But sometimes it may possible कि ये सिम्टम्स आते ही नहीं है कई सालों तक या पेशेंट को पता ही नहीं रहता है कि he or her having a PTSD. So one of my patient came to me with a complaint of the sleeplessness, नींद नहीं आ रही है, concentration में difficulties हो रही है, confusion बहुत ज़्यादा होता है, depressed feeling होता है. So when I took his all the history, I get to know that कि all his symptoms started after the death of his father, and his father died 2 years ago. But he doesn't know that कि उनके फादर के डेथ का ट्रॉमा उनके मन पे इतना ज्यादा लगा है that he is suffering from the PTSD. So if the symptoms causes a significant problem in your social or the work situation or in your relationship, and it can interfere with your ability to go about your normal daily tasks, and you're having a difficulty in your work, in your life, in your sleep, in your appetite, you must take a help. So the PTSD symptoms are generally grouped into the 4 types. First is the intrusive memory. Second is the avoidance. Third is the negative changes in the thinking and the mood. Fourth is the changes in the physical and the emotional reaction. We'll see that. First is the intrusive memory. Intrusive memory मतलब कि आप खुद के ही थॉट में इतने ज्यादा हो कि आपको समझ में नहीं आ रहा है कि क्या हो रहा है. You are getting that all the flashbacks of your traumatic events, the recurrent unwanted distress memory, upsetting dreams, or the nightmares. There is severe emotional distress and the physical reaction that reminds you of the traumatic events. So, जैसे मैंने एग्जांपल पहले बताया कि मेरा अगर एक्सीडेंट हुआ है एंड अगर मैं टीवी पे या न्यूज़पेपर पे कहीं पे एक्सीडेंट के बारे में सुनती हूँ तो आई एम गेटिंग दैट इंट्रूसिव मेमोरी कि मेरे साथ क्या हुआ था. सो all that negative thoughts coming into my mind that am I going to crazy? No one is understanding me. There is something must wrong with me. I'm not able to focus on anything. And all these thoughts are so overwhelming that I am feeling tired. Another is the avoidance. That we try to avoid the thinking or talking about the traumatic event to anyone. We try to avoid the places, the activity, the people that remind you of the traumatic event. So one of my patients is having a fear of the lift. Why? Because एक साल पहले जब वो लिफ्ट में जा रही थी तब लिफ्ट अचानक से बंद हो गई and she get trapped in the lift for about half an hour. After that incident, she avoid the lift. Like उसका घर 7th floor पे है, still she go by the stairs, but कभी lift नहीं use करती because by entering the lift itself, by thinking about the lift, she's getting all the palpitations, all the fear, all the bad memories कि उसके साथ वो half an hour में क्या हो गया था. So all वो traumatic events याद आता है and she try to avoid talking about it with anyone else. Like ना friends के साथ बात करनी है उसके बारे में, ना किसी को कुछ बताना है. so that she feel that कि अगर मैं बात करूंगी तो वो प्रॉब्लम और ज्यादा हो जाएगी. But in the contrary, when you focus on the problem, or when you talk about that, that problem may get resolved. Another is the negative change in thinking and the mood. So you start thinking negative about yourself or people in the world. You feel hopelessness about the future. You're having the memory problem. You're having a difficulty in maintaining relationships. You feel detached from your family or the friends, or you feel lack of interest in activity once you enjoy. Like I enjoyed doing the painting, but after the traumatic event, maybe the death of my loved ones, or maybe the accident, or maybe some major event, I stopped enjoying that. I'm doing that, but I'm not enjoying that. So difficulty in experiencing the positive emotions, like आजू बाजू positive बहुत सारा हो रहा है, but I am not experiencing it. I am feeling numb. So that emotionally feeling numb is one of the major sign and the symptoms of the PTSD. The changes in the physical and the emotional reaction. You may get easily startled and frightened. You may having a destructive behavior. Like you try to avoid that thinking. तो वो avoid करने के लिए you may start drinking alcohol, smoking weed, or you start driving too fast. This is also the negative type of the behavior. That you're having a trouble in sleeping, you're having a trouble of concentration, your nature has become more irritable, aggressive. इन चिल्ड्रन भी सी दैट कि अगर स्कूल में बहुत ज्यादा बुली होता है कंटिन्यूअसली, अगर वो हो रहा है, दैट इज ऑल्सो अ ट्रॉमेटिक इवेंट फॉर अ चाइल्ड. अगर वो कंटिन्यूअसली हो रहा है तो दे स्टार्ट शोइंग सम बिहेवियरल चेंजेस. सो द एग्रेसिव बिहेवियर, बहुत ज्यादा एंगर आउटबर्स्ट होना या इरिटेबिलिटी होना या कॉन्सेंट्रेशन ना लगना स्टडी में. दिस इज ऑल्सो वन ऑफ द साइन एंड द सिम्टम्स ऑफ द PTSD. The overwhelming by the guilt and the shame. So these are the major signs and the symptoms you must look for any person. All the intensity of these symptoms are vary from person to person and also vary from over the time. So for example, accident ke baad I may started frightened or I may get fear of driving, but slowly over the period of time, I may get overcome by this. But some people can't. So maybe when you are in stress, these symptoms may intensity you feel too much. Or when you are generally calm, may intensity get calm down. So it also varies from person to person. So when to see a doctor, this is very important. If you are having a trouble in your thought, behavior, or your feeling about the traumatic event for more than a month and you feel it very severe, what is meant by severe? Severe because if it's affecting your daily activity. So daily activity, you are having a problem in relationship, you are having a problem in your work, in your sleep, in your appetite, in your body, and you feel that you are not getting your life back under control. So you must take a help from the professional. So today we see about the sign and the symptoms. In the next video, we will see how to manage these symptoms and how to take a help and what are the different treatment for the PTSD. Thank you.